I'm the executive director at the East Village Animal Hospitals. We have a location in London and we have a location in Kitchener. We operate as a nonprofit, so every other day of the year in non-pandemic times, we are extremely busy. We service only low-income pet owners, families, folks on social assistance, and rescue organizations. And I can safely say that during COVID-19 and during our state of emergency, we are just slammed. We are trying our best to answer the calls, answer the emails, while still abiding by strictly adhering to all of the guidelines that have come through with public health. Veterinarians are allowed to provide essential, urgent care, and this has different meanings for different pet owners. So I think that that's certainly one of the challenges that people have. Something that has been going on for 6 months and now is becoming worse. That's pretty difficult to prioritize over something that has just occurred within the times of COVID-19 and an animal is acutely unwell, not able to wait 24 hours, not able to wait 48 hours. So it's really, a challenge on the front desk, on the staff, on administrative teams in veterinary clinics to constantly try and triage every single call, of course, that's coming through. And I think once we get to that point of being able to open up a little bit more, that's great. We'll be able to catch up with all the healthy pet exams and your yearly vaccines. But certainly at this time, we simply don't have the staffing, for one thing. We are so busy with urgent care, and you need to stay home. Anything we can do to avoid having to ask you to leave your house, that is what we want to do. So we have telemedicine in place. We have amazing licensed veterinarians who are communicating with people via Skype, Zoom, telephone, helping you. We are delivering hundreds of prescriptions, medications, prescription diet to folks in the Kitchener area and London area a couple times a week. So whatever we can do to encourage you to stay home, and that includes explaining to you how to trim your pet's nails. That is not something you should leave your house and go to a veterinary clinic for. So you're welcome to email, you're welcome to call. We will walk you through the list of what we're able to do, what we're able to provide, and keep everybody as well as possible so that we get through this and then can open up our services to everyone again. Something that I would ask the public to keep in mind is when you're calling your veterinary clinics, our two locations, we have thousands of people calling us, and we have a couple of people who aren't isolating at this point, other than when they're at work and when they're at home. So they are still coming into work. They are still deemed essential. So everybody is feeling anxious. Everybody is feeling very stressed. So I would ask all callers to be mindful, be respectful, and to please understand that all clinics, all team members are doing our very best. And, we know that we would be safer at home. We know our families would be safer if we stayed at home, but we have a strong, deep commitment to animal welfare, and we choose to keep the clinics open and to help you in everybody's time of need. So I really appreciate those folks who are being respectful and understanding when they're calling us.